Is high blood pressure being treated too aggressively? That's the subject of an in-depth article by a physician looking at blood pressure management dating all the way back to 1948 when the start of the Framingham study, which is a study that's still going on in its third generation. Hi, if you're new to my channel, my name's Brian and I practiced medicine for 30 years in women's health. And I spent a lot of time dealing with high blood pressure because most women use their gynecologist as their primary care physician. So let's delve into blood pressure treatment. Most of the discussion of this information would be taken down, so I'm going to do the full run through on the Health Without Risk app so that I'm the moderator. But let's look at some of the information that is from this article. A reevaluation of the Framingham data was published in 2000, looking at adults being treated for hypertension between the age of 56 and 64. And this is a modified graph by this author based on that reevaluation of the data. So it's assumed that high blood pressure is linear as far as death rates. So this is the logistic linear relationship. But when reanalyzing the data, so normal blood pressure, they're saying up to 150 in that paper, with the current guidelines from 2017 showing a high blood pressure threshold of 130, you get this type of graph. So no change in death rates up to a systolic blood pressure of 150, and then it starts going up. So evaluating that data shows that the shaded area here represents people being inappropriately treated for high blood pressure. So from 140 to 160, this is in people 56 to 64, based on that reevaluation of Framingham data. One of you asked me to look at side effects in the data for amlodipine, which is a calcium channel blocker. So we'll look at some of the side effects of the different classes. There's 4. One of the issues with getting your blood pressure too low is that you can fall. So this JAMA Network study from 2014 looked at that for various classes of medications, antihypertensive medications and serious fall injuries for older adults. And interestingly, the biggest risk factor as far as class of medication for serious fall injury were the calcium channel blockers, amlodipine being one of them. Calcium channel blockers work by decreasing the force of contraction of the heart muscle and dilating this vascular smooth muscle, releasing some of the backflow or hypertension, as well as slowing the heart rate just a bit. One of the problems with calcium channel blockers, however, is up to 16% of patients get edema or swelling in the tissue throughout their body. Other frequently reported side effects with calcium channel blockers is lightheadedness and dizziness, as well as constipation. This is more common in older adults. So we'll look further into the data from the Framingham study and the fact that we may actually be over-treating high blood pressure, especially in older Americans, leading to all kinds of problems. But we're going to have to do it on the app because it'll get taken down on any other platform. Other studies that have been done and ignored showing that perhaps we are over-treating high blood pressure, especially in people over 60. So have a great rest of your day. Stay tuned and I'll talk to you soon. Bye.